Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accept it. Call Dr. Lederman at 212-CHOICES. 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super. In Manhattan at 38th and Broadway. Custom-tailored treatment to hit the cancer. Call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212-CHOICES.
WOR, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back, and we're taking your calls. We're talking about cancer, cancer news, cancer cases. We're talking about our own facility, which is devoted to you and the patients who need cancer treatment. We're a private cancer treatment center, so you won't get bills. I don't know if you saw the article in the New York Times. This patient had surgery for his spine, and unbeknownst to him, another doctor walked in the room and was an assistant and sent him a bill for $120,000 and collected. Wow. So it's good sometimes to be awake, to stay out of the hospitals, not get super infection, not get super bills. That bill was a patient in the New York area. You can look in today's New York Times and read about it. It's really shocking. No, we take most insurances, Medicare, Medicaid. We deal with you in a straight way. We have our own hyperthermia facility where we actually heat certain cancers. It's been known for a long time that if you heat cancers along with radiation, you increase the chance of success. So certain cancers is something we'll talk about if you wish to give us a call. Our number is 212-CHOICES, 212-246-4237. We don't have students. We don't have residents. You have real doctors and real people answering the phones, meeting you and taking care of you and following you, the same doctors over many, many years. So you're welcome to give us a call if you wish, or even better yet, to come in. We had a gentleman, 51 years old, who came in with a meningioma. He came in for a consultation. He's been followed since 2009 with this tumor in the brain. Meningiomas are a covering of the brain tumors. The covering of the brain is called meninges. A benign tumor of the meninges is called meningioma. Now, it's a little bit unusual because about 6 or 7 times more women get meningiomas than men. But obviously we see so many patients that we see most everything you could imagine. Now, this tumor has been growing by about 10% a year. He's been followed by neurologists. This has been since 2009, so 10% a year over 2009, 10, 11, 12, 13, 14. You can imagine it's growing. He's been hospitalized for cellulitis, and again, we just talked a few minutes ago about infections and hospital stays, so it makes people nervous because even normal, healthy people can get a super infection. So our data for meningiomas actually shows a very high control rate. Our control rate, which means to stop, shrink, or make that meningioma go away, is 97%. We were the first in New York with brain radiosurgery. Radiosurgery is a misnomer. It allows us to send in beams to hit the tumor, whether it's cancerous or not, and we do treat benign tumors in the brain as well as cancerous tumors in the brain. So common benign tumors are pituitary tumors, meningiomas, acoustic neuromas. Common cancer tumors in the brain are glioblastomas, astrocytomas, metastasis. Metastasis are cancers that travel through the bloodstream that get to the brain, and the brain gets a lot of blood. The brain uses a lot of nutrition, so it gets a lot of blood supply, and that probably is why many cancers spread to the brain. So if you're having headaches or neurologic symptoms, you may want to give us a call, or best yet, to come in. This man came in. We talked about our data, non-invasive treatment for meningiomas, which is highly successful. And of course, after treatment, we follow the patient to make sure the patient has had good results. And we had a woman who came in. She was a Moroccan-born woman, 77, 3 children. And she had abdominal pain, and she went to a couple hospitals. A couple big hospitals wouldn't take her insurance, and so she went to another hospital, and they did surgery on what was thought to be a pancreas cancer. They opened up. They found a lymph node. They closed her up. Her scar is about a foot long. It's incredible. And a 77-year-old woman. And what's most interesting, they opened her up without really the best staging. There was no MRI, no PET scan. They opened her up, took out a lymph node, said it's cancerous, and closed her up. So she's had all the suffering of a big operation, this huge scar, and because it traveled to an adjacent lymph node, they just closed her up and sent her home, not for good reason, not for good news for her. So she came in. We actually staged her up. She came in at 3 o'clock last couple of days ago, and by 4:30 we had a PET scan arranged. We got approval from the insurance company. We got her staged, and the good news is that her pancreas cancer is localized. We have a very enviable track record of treating pancreas cancer, both in the pancreas in newly diagnosed patients like this woman, or even in patients who've had recurrent cancer in the pancreas or lymph nodes or liver. Our success rate is over 90%. We've presented that data at medical meetings, and I'd be happy to go over it with you if you wish. For this woman, we've got cancer markers like CA19-9 and CEA, which should be done. Those are simple blood tests, and they're blood tests that allow a patient and the family to have an idea if treatment's working or not, which is very useful to have a baseline. That she got an only PET scan to show the extent of disease, which is only in the pancreas. So with us, she'd have a high success rate and high degree of control, and of course we would follow her over time. So she chose surgery, didn't work. She came to us, staged her up, and now she gets to decide if she wants radiosurgery or not. And we had another man who came in this week with a Gleason 8 cancer. This is a man that works on Broadway. He had a PSA that was only slightly elevated, 4.15. So most people say, oh, it's just a little bit over that number, that bewitching number of 4. But he had a biopsy, and the biopsy showed Gleason 8 in multiple cores. So Gleason was his pathologist and tried to tell us how aggressive cancers would be. Gleason 8 is very aggressive. And if you look at the data, if you open up our booklet, and we can send you the booklet if you wish, page 11 of our booklet is our data for Gleason 8 cancer, and we compare it to 2 big hospitals, one in Boston and one in Philadelphia. We have other comparisons in the book with Proton Beam and other centers, and you'll see that our results in the comparison to the Boston, Philadelphia big hospitals were about 120% better than they in making the cancer-free, the patient cancer-free, years after treatment, 5 years after treatment. So where you go does make a huge difference. And there was a recent report from Boston showing that men who had surgery, well, about 97% of men having surgery, open or robotic, had sexual problems. Men who had open or robotic surgery had urinary problems, 80% with open and 86% with robotic. So clearly robotic wasn't better. In fact, it was a little bit worse. Our patients have a much greater degree of urinary control. In fact, almost every man controls the urine. They come in with urinary control. Most likely they'll keep their urinary control, and the vast majority of our patients undergoing prostate cancer treatment are sexually active and continue to have those quality of life. So most of our men that come want to avoid radical surgery, have a higher success rate, keep their urinary life, keep their sexual life. And you may want to give us a call. It's probably in your interest to give us a call before you have treatment for that prostate cancer. Before is better than late. And while we're in the prostate area, here's a woman that we just treated. She had a bladder cancer. She came from New Jersey, and she went to a hospital in New Jersey for the bladder cancer. They wouldn't treat her. Then she went to a huge cancer hospital nearby us, and they sent her home to die without treatment. They told her there's no treatment. She had a bladder cancer. We saw her. I felt that we'd have a good chance of treating her. And we've had quite a few dramatic cases with bladder cancer this year that we've discussed on the radio. This woman had 5 treatments to the bladder cancer. She's had follow-up scanning, which shows the cancer's in remission, doing well, fully active, no new sites of disease. She's home, active, doing what she wants when she thought she was going to be on hospice. Wow. If you can be in remission, home, doing what you want, versus hospice, that's a pretty easy decision for any one of us, isn't it? And we had a man who came in with an elevated PSA, man, 60-year-old man, whose PSA was elevated. He had a biopsy in the past, and we're seeing him back. Now he has pain in his flank, so we're going to evaluate his flank pain. Now that might be a kidney stone. It could be cancer that's spread. We don't know yet. He just came in a day ago. So he's getting staged up, repeating the PSA, getting an ultrasound of the kidney, and seeing exactly what's going on with him to try to get his situation diagnosed. He knows what's going on. His doctors know what's going on. And then he can make a decision about what to do about it, which is, I think, what everyone wants to do. They want to know what's going on. Give me information. And we try to provide information, and we give you copies of your reports so you can go home and read about what you have. We find so commonly, most people don't even have the paperwork showing what kind of cancer they have or where it is. We're just the opposite. We try to provide that information, share it with you, share the images with you, so you can participate, read, and study your situation, which we think is only right. And we had another gentleman who came in with metastatic lung cancer. This is a man who had a stroke, and he had neurologic symptoms, and he was seen by other doctors, and no one did a scan of his head, even though he had lung cancer. So he came to us. Again, we staged him up, and it may sound boring to stage people up, but we found a cancer that had traveled to his brain, where other doctors thought, oh, he just had a stroke, leave him alone, you don't have to check his brain. So it's better to know where the cancer is by finding the cancer in the brain before it causes damage to him. We can treat it, most likely control it, and most likely keep him neurologically in better shape than he would be if the cancer was growing in the brain, because when cancer grows in the brain, it puts pressure on the brain. The skull is kind of a cage for the brain, so there's nowhere for the pressure to go, and what happens is the pressure increases the harm to the healthy surrounding brain. So with this man, we were able to diagnose his cancer, treat his cancer in the brain that had traveled through the bloodstream to the brain before any harm. We're going to stop for just a moment. We're going to hear from a couple new voices, and we'll be right back to take your calls. This is Dr. Lederman, cancer treatment doctor, representing Radiosurgery New York, which is a cancer treatment center in the heart of Manhattan, 38th and Broadway. We take most insurances, Medicare, Medicaid. It's a private cancer center, taking you, treating you, working for you, not taking money from insurance companies that want to pervert the system, but taking most insurances, Medicare, Medicaid, and not being involved with pharmaceutical industry or surgeons that try to do things that you may not know or like. So here's the voices, and we'll be right back.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient